The goal of the entire admissions team is determining the skill sets, the experiences, and the academic credentials and accomplishments that this individual person brings to the table. What we want to see are the raw ingredients, the track record, but then the potential to go that next level.
I chose the Perelman School of Medicine because I'm a student who's really interested in healthcare entrepreneurship and the intersection of business and healthcare.
For me, it was because there is such a large physician scientist training program here.
It's the curriculum and kind of like the academic prestige, you could say, of the school.
Working towards a diverse student body, an experientially diverse student body, is one of the things that we put a lot of attention on. So there are 10 cultural affinity groups that we specifically support through my office.
Penn supports diversity, equity, and inclusion, most importantly because they're funding groups targeted towards that and giving us, the student body, the ability to say, this is what we want to see done, and then help us work with administration to put on events related to diversity, equity, and inclusion, and just support belonging overall on campus.
We have 3 free afternoons a week to either do medical focused things like the free clinics, go running, ride horses, bake, really whatever makes you happy. They make sure that you have time in your schedule.
As the Dean for Student Affairs, I make sure that they feel welcome, that they feel connected, that they are well resourced during their time here.
We have the house system here, so the students, 156 of us in each year, are divided into 4 houses.
And within each house, there are 6 learning teams made up of 5 to 7 students. And these are the students that you're going to be working with for the preclinical curriculum.
It's so nice to have a group of people that you see pretty much every day. We're all friends. We just had brunch last week. I didn't realize how important that would be to me before I started medical school.
Students are engaged in learning in the context of a clinical space. And of course, the students get to have a multitude of clinical experiences in the new pavilion. What could be better than that?
I'm standing in the new north lobby of this absolutely stunning pavilion. For medical students, one of the first things you're taught in taking a patient's history is how to listen to the patient's narrative, their personal story, as well as their symptoms. Because of this perspective, the pavilion has been designed to seamlessly weave together a patient's individuality and life experience with the finest healthcare technologies and practices.
The medical campus is beautiful. It is so modern. It is so technological. I love it. It's integrated into the hospital system. So when you walk into the medical school, you get to see patients in the lobby of the hospital, patients going to their appointments.
Seeing patients come in, knowing they're coming in to receive medical care at the place I go to school, reminds me of why I do it.
At University of Pennsylvania and at the Perelman School of Medicine, we're always thinking about the next greatest thing, and in fact have contributed to society most recently with our messenger RNA technology, without which we wouldn't have the vaccines that have allowed us to really get to the next level of the current COVID-19 pandemic.
You walk around these halls, you see people whose names are in the news, right, on a regular basis, talking with medical students, with residents, right?
My lecturer is coming in to talk about the mRNA therapies that he and Dr. Carrico invented. My primary activity right now is to do my second lab rotation, and this is a really great opportunity for me to see if this is a lab that I'd be interested in joining for my PhD thesis.
One of the opportunities that I've taken advantage of is a partnership that Penn have with the American Society of Clinical Oncologists, and it's given me the opportunity to explore a bunch of different fields within oncology, be it radiation oncology, surgical oncology, medical oncology.
We actually have a number of community engagement organizations to provide either clinical, medical care, or some kind of social service in West Philadelphia and South Philadelphia.
One of the things I'm doing is running one of the free clinics. It treats patients specifically with diabetes and hypertension, and we provide them free medical care, try to get them health insurance if they don't have it, and try to connect them to long-term primary care.
Philadelphia is special because it's a small, big city. You can kind of carve out a community for yourself. You find there are enough people here that you'll find people who share interests.
It's not too big, but it's also not too small. So there's definitely a lot of things to do, but it's also very accessible through public transportation, and it's also very walkable as well, which is great.
I've recently really loved going on runs on the Schuylkill River Trail and all the food here, that's so good.
Our students find that Philadelphia is a great place to live and also a great place to receive an outstanding education.
We have premier campuses and graduate schools in virtually every industry. And I can't think of one that doesn't connect to medicine and to medical research somehow. And I don't know any other campus that compares to University of Pennsylvania in that regard.
Done a lot of reflecting lately since we're a year in, and I can't believe the person I've grown into over the last year here.
Every day I wake up and I still can't believe that I'm studying at the Perelman School of Medicine. And I am so sure that it's going to prepare me better than any other place to become the physician that I want to be.
We truly hope that the Perelman School of Medicine, where we are shaping the future of medicine, is where you'll decide to pursue your own future.